Doctor, can we talk about the different types of ways of taking the HRT specific to breast cancers? Are you recommending the patches and the gels? So transdermal versus oral, what is your recommendation for patients, or is it very individualized?
So if we get to the point that and it's really important to have a shared decision making, where this isn't the 60s where you don't, we're not paternalistic, or we shouldn't be paternalistic anymore. I mean, so we should be having these shared decision makings with the patient. So if we've agreed to try HRT, then I think there is a huge misconception that transdermal is safer than oral with regards to breast cancer risk. So with regards to blood clot risk through the skin is safer than oral. But actually for breast cancer, there's no difference between through the skin or oral. And again, there's this misconception that it's body identical estradiol is safer. But actually, all the evidence we have is it's actually the conjugated estrogens. We've got so much data and data from the WHI trial. And although that was the WHI has kind of been the bane of women's health, but it was reported badly, but we've got good data from it.
Okay.
So we can see that with the conjugated estrogen, which is the Premarin, pregnant horse urine, if you've got estrogen alone, you've either got no increased breast risk or probably 23% lower risk of breast cancer and about 40% lower risk of dying of breast cancer. So this is women that haven't had a breast cancer.
Wow.
And in the habits trial for women with breast cancer, it did show recurrence, but actually not the women that were given conjugated estrogen alone. So women who didn't have a womb could be given estrogen alone. So the ones that had conjugated estrogen alone, they didn't show an increased risk of recurrence. And with the conjugated estrogen, I like to say to women, it's like a bag of sweeties, and they're all different sweeties, and it's the same in the conjugated estrogen. It's all different types of estrogen, and they all work in a different way, and some are breast protective, some are breast neutral, and some may be worse for the breast. Whereas your body identical estradiol, which we still use and I still do use, is just basically one type of estrogen, estradiol E2. There is HRT that's not available in the UK, but it is available in Canada, called Duavee. And they actually just presented a study at ASCO this summer that was really exciting. And it was called the PROMISE study. And what it did is it looked at women with DCIS, which is stage 0 breast cancer, so non-invasive breast cancer. And they gave them a few weeks of Duavee, and then they rebiopsied them and they looked at a marker. It was a protein marker called Ki67. And they looked at this marker to see, has it reduced your risk of your breast cancer developing into an invasive cancer or reduced risk of recurrence? And they had really positive results, and they all had lowering Ki67. So it was really encouraging. So what Duavee is conjugated estrogen, oral estrogen, and it is something called bazodoxifene. And what bazodoxifene is, it's a serum, it's like tamoxifen, and it seems to have more of a blockade to the womb and the breast and seems to be protective to the womb and the breast. So I think watch this space with Duavee, because I think down the line this is going to be a really promising HRT.
Yes.
We don't have that in the UK. So in the UK, in practice, I will tend to use estrogen through the skin because any woman who's had a cancer is going to be at slightly higher risk of blood clots simply because of having cancer. So I think, okay, why take that risk? So I will give them estrogen through the skin, and there's no difference between patch, gel or spray. It's all just personal preference. You can kind of bung a patch on, forget about it, or some women love the routine of doing something every day with their gel or their spray. So they're all pretty much same body identical estrogen through the skin. And then if you have a womb, you need to have progesterone to protect the lining of the womb. And we much prefer to give a breast-friendly progesterone, so micronized progesterone. I think it's called Prometrium in Canada. Micronized progesterone, it is neutral to the breast. Because we think
Right.
actually the whole issue with HRT is not the estrogen,